say the word wart, what comes to mind? A frog? A witch's nose? And so today we're talking about witches and frogs. Just kidding. But we are talking about warts, which are small overgrowths of cells that most often appear on your hands and feet, but can appear pretty much anywhere. Are they dangerous? No. Are they kind of embarrassing and just annoying and like, yeah, what are you doing there? Yeah, that's pretty much how they are. Or at least that's how they were for me. I, in my life, have had two of them. One was on my middle finger right there. It's gone now. The other one is on my knee. Was on my knee. I don't have them anymore. But when I did, I picked and scraped and gnawed and clawed those little bastards trying to get rid of them. Interestingly enough, this is actually the worst thing you can do if you have a wart, is to mess with it. But what can I say? I'm a picker. I've always been a picker. If I've got a tag, a scab, or a skin irregularity, I am going to pick it. I can't help it. It's just what I do. Telling me not to mess with something that's like on me or is like setting a hot pizza in front of me and telling me not to have a slice. It's impossible. Now I'm hungry, but it's gonna have to wait because today, gentlemen, we're talking about warts, how you get them and how you get rid of them. Please note, this video is not dealing with genital warts. I already did a video talking about STDs, alright? They're similar, but different. If you missed that video, it's listed and linked in the description. The common wart, actually, genital warts are pretty common, but the common wart that we're talking about, the ones that you get on your hands and feet, and you can get on your legs, knees, anywhere actually, is caused by a virus. So there you are. You have a cut. You picked a nail. There's some way for this virus to get into your skin. Alright, and when it's in there, it's actually causing an infection at the top layer of the skin. This is what's actually causing your warts. And this virus causes an overgrowth of cells, and that's what a wart essentially is. A lot of times, if you've had them, or if you have them now, if you look, they're on your fingers, maybe around your nails or on your feet, by your toes, right? This is because that's where the entry point is actually happening for the virus, alright? You pick, you scratch, you bite your nails, and it's getting in there. So who can get warts? Pretty much anybody can, but they're most common in teens and children. The good news is that warts, most of the time, they just go away on their own. Alright, you just leave them, they don't do anything, and it generally will clear up over time. But the issue is time. How long is it going to take? Is it going to take a week? Probably not. Is it going to take a month? It could take years. And so there are some things that we can do in order to help speed the process up of getting those little bastards off our body. There are 4 ways to get rid of them. 5. Time. A lot of times we'll heal them, but number 1 and the most common treatment for warts is acid. Alright, and what you do is you just go buy over-the-counter acid, Compound W, there are a lot of different brands, and you actually paint it on a lot of times the wart. Just let it hang out. You can put a band-aid over it just so that things don't get on it and mess up the acid that's on there, or you can actually buy an acid pad. It's a little sticky thing with the acid on it. You put it on, when it falls off, you put another one. It's a process. And what's actually happening with this acid, it's shedding the layers of skin. Eventually, the idea is that over time, you shed enough skin and the wart will dissolve. Now, if you're a doctor, you're cringing at my explanation, but you get the gist. That's essentially how it works. The second option is freezing. Psst. You hit it with this super cold blast of spray. I don't know if it's like nitrogen or whatever, but what happens is you freeze it. It turns into a dark, discolored, like blood blister, and then it falls off a lot of times. I would say if you're going to be doing this, don't do it on your own. Go to see a dermatologist because they are in the business of blasting warts with cold stuff. Number 3 is laser. You can go and have your warts laser zapped. Alright, just like I go and get my tattoos worked on, same sort of thing, same concept. You're blasting the wart with a laser, and it helps remove it, it helps break it down. Actually, I don't know how it works. But I know that it's a treatment and it does work. And the 4th, and what I think is quite possibly the most awesomely masculine option, is duct tape. Duct tape, seriously. You know that silver really stick? Yes, there have been studies done that show that if you cut a small piece of duct tape, put it on your wart, and just leave it, when it falls off in a few days, put another piece on there. It actually, for some reason, I don't think anybody actually understands why it works, but duct tape, it works. It basically can help you get rid of warts, and it's cheap. But the problem with that is that you got a piece of duct tape on your hand, and then everybody is going to be like, "Yo, Johnny, you got duct tape on your hand?" And then you're going to have to explain, "Yeah, I got a wart." Tell them to shut up, mind their own business. You're like MacGyver of wart removal. Yeah, duct tape is what can't duct tape fix? That is my question, gentlemen. Warts, they happen, caused by a virus. It's actually an infection in the top layers of your skin that causes excess cells to grow. Are they dangerous? No. Are they a pain in the butt because you got to deal with them, look at them? Yes. Should you bite them, pick them, try and scratch them off? No, because they can actually spread. You want to make sure that you're taking care of them the right way. Today, I gave you 4 of those reasons, or not reasons, ways in which you can take care of your wart.